Yes, so welcome once again to today's webinar on what everyone must know about diabetes. I'm Portia Kotoboateng. I'm here with Ivan Sakuma. We are the two moderating this very webinar. And leading us in this conversation is our physician specialist, Dr. Alfred Lutterodt. He'll be taking us through this particular webinar, and it promises to be very, very insightful. So before we begin everything, I would like to say that Ghana, Canada is located off the Trasacco Road in Adringano. So our services include pediatrics, general medical consultation, internal medicine, obs and gynae, dialysis. We have a surgical unit, urology, laboratory, ENT services. We have a pharmacy, ophthalmology, and also optometry services. And so if you have any health concern, you want to come to Ghana, Canada, and we'll take very, very good care of you. So we want to keep our backgrounds very, very muted so that we don't get distracted. And if you want to on your video, you want to keep it very professional so we don't see things we don't want to see. If you have a question, you would like to wait so that after the presentation, you ask your question. So you can raise your hand and you'll be called by either the IT specialist or myself, and then you talk. And if you give room to whoever is talking to finish talking before you interject. So without much ado, I would like to call on our physician specialist, Dr. Alfred Lutterodt, to take us through what everyone must know about diabetes. Dr. Lutterodt.
Thank you, Portia.
Welcome, sir.
And welcome to everyone to this seminar. As you've been told, the topic is what everyone must know about diabetes. So we begin by asking ourselves, what is diabetes? It is a chronic, lifelong disease that shortens life expectancy by anywhere from 10 to 15 years. It is due to the lack of insulin, which is a hormone which enables the body to make use of sugar or glucose as energy source. In this condition of diabetes, therefore, the blood sugar reading is higher than normal. In the diabetic condition is associated with serious complications, and hence the shortening of the life expectancy of the diabetic. All is not bad. The good news is that with good control, one can prevent complications of diabetes. Very vital for achieving good control of diabetes is the full participation of the patient in the management program. The patient must take ownership of the program and abide by or comply with all the medical advice necessary. There are different types of diabetes. The commonest type usually occurs in adults and hence is called adult onset diabetes. Doctors know it as type 2. It's far commoner than the second type, which begins in childhood, invariably before the age of 30. And this is called juvenile onset or type 1 diabetes. In some patients, diabetes manifests itself during pregnancy. So this is called pregnancy-induced diabetes. In all the different types, the common thread is that of lack of insulin. And sometimes there is a component of the disease that is due to inability for the body to use insulin, which may be adequately, I mean, sometimes more than needed, available in the body. Now, who is at risk for developing diabetes is a very important question. Who should watch out? So if you are told by your doctor that you have pre-diabetes, it means you are at the doorstep, and if you cross the door, you become diabetic. So if you are pre-diabetic, then it means you should be on the lookout for the day you cross the door into the room, and then you become a diabetic. If ever you have had pregnancy-associated diabetes, then you ought to be on the lookout, because in the future, you may develop full-blown diabetes. Obesity is on the rise worldwide, including Ghana, because of changing lifestyle and adoption of meals or food that 50 years ago was uncommon in this part of the world. So we have a measurement. You all know weight and you know height. And when we relate the two together, weight and height together, we get what doctors call BMI. And when this is more than 25, then you are said to be overweight. Over 30, you are obese. And then if you fall into this group, then you are at increased risk for developing diabetes. In a way, age is a risk factor, particularly for the type 2 or adult onset type diabetes. So as one gets past the age of 45, one should be on the lookout for developing diabetes through regular, yearly or every 2 yearly checkups. Now, if you happen to have a first-degree relative, that is parents or siblings having diabetes, then that person is at increased risk for developing diabetes. Physical inactivity or lack of exercise will also contribute to the development of this chronic lifestyle disease. It turns out that we of the African race are more prone or predisposed to the diabetic condition. We can't do anything about our race, but we have to be on the lookout for this reason, because we are at increased risk. How does one know if he or she has diabetes? If you have any of the risk factors I just outlined in the last slide, then it pays to be on the lookout. And secondly, a patient who develops diabetes will have certain symptoms which everyone should be aware of. And as soon as a person develops those symptoms, should immediately seek medical attention. So diabetes can lead to unexplained weight loss because you are losing the energy in the food that you eat in the form of sugar in the urine. So sudden dramatic weight loss could be a sign of the onset of diabetes. Patients who have diabetes develop unexplainable tiredness for no good reason. because they lose a lot of fluids or water. Patients who develop diabetes at the onset will notice that they are drinking more water than they used to, or they feel thirsty all the time. Sometimes at night, they have to get up and pass urine, and at the same time, drink a glass of water because they feel thirsty. So the development of excessive thirst can be a sign of diabetes developing in a person. I've mentioned about frequent urination. And what's unique about increased frequency of urination in diabetes is that when the person passes urine, it's like a tap has been opened. In other words, you pass lots of urine and frequently. Another early symptom that should alert a person to the possibility of diabetes is development of blurry vision. For those of you who drive, if you start having difficulty with reading road signs, then be on the lookout. It could be a manifestation of diabetes developing in you. Continue with how does one know if he or she has diabetes? The previous slide outlined the symptoms. Now, this slide, in this slide, I stress or mention that examination or consultation with a doctor will help if you have the symptoms that are outlined, or if you have the risk factors that are outlined. And then the physician or the doctor will talk to you, take a good history from you, examine you, and then request the correct tests to confirm whether your symptoms indicate development of diabetes or not. And some of the appropriate tests that will be done will include what we call a fasting blood sugar. That is, after about 12 hours of eating no food overnight, you will go to the lab and get your blood sugar tested. And if the sugar is more than 7, it's indicative of the person, but especially if you have the symptoms, that the person has diabetes. In addition to the fasting sugar, we do after meal, 2-hour after meal sugar, blood sugar. And if this is over 11, again, it's suggestive of or confirmatory of a person having developed diabetes. In addition to these blood sugar tests, we have a special test that gives us an idea of what a patient's blood sugar has been for the preceding 3 months before seeing the doctor. This test, everyone should know, is called A1C test, and is measured in a blood sample in the units of a percentage. So anyone who has A1C test greater than 6.5% is considered definitely to be diabetic, particularly in association with a high fasting blood sugar. Your doctor will, in addition, likely ask for a measurement of your blood cholesterol, which is commonly high in diabetics, and the two together can cause major problems for the diabetic, particularly the complications I'll be talking about in a moment. Your doctor very likely will request a kidney function test to see how well your kidneys are functioning, because diabetes adversely affects the kidney You all hear in the news the rising incidence or prevalence of kidney disease in Ghana, and no doubt diabetes is one of the factors leading to this increased occurrence of kidney failure in Ghana, and in fact, the world at large. Your doctor may request a test on the heart called an ECG, which is a tracing of the electrical activity of the heart. And from the tracing, we can determine if some damage has been done to the heart muscle. The ECG can tell. And the peculiar complication that we generally look for can be silent. In other words, you can have it without having any symptoms. So that's why even in the absence of symptoms, we still do the ECG test to find out whether quietly you have had a heart attack in the preceding months or years. This slide shows long-term complications of diabetes that lead to a decrease in life expectancy of the diabetic patient as compared with the rest of the population that do not have diabetes. And the complications, as described, are long-term. In other words, they live with you for years. And so quite apart from shortening your lifespan, they also decrease the quality of your life because the complications stay with you for a very long time until you finally succumb. Doctors are on the lookout for heart-related complications if you have diabetes. Diabetics are very prone to heart issues in the form of a heart attack. And in a heart attack, the heart muscle or a portion of the heart muscle dies and becomes useless. Consequently, the heart is unable to pump as well as it should. And that can result in what we call heart failure. Patient will be breathless. Heart attack, common in diabetics. And the patient may report or experience unusual chest discomfort in front of the chest, heaviness in the chest. Will the heaviness go into the neck and the jaw or into the arms? At the time of having a heart attack, in addition to the discomfort in the chest, the patient may sweat profusely. The patient may feel like fainting. In fact, in one form of heart attack, the patient may even vomit as if she has food poisoning or stomach inflammation. So heart attack. Now, diabetics, sometimes when they have a heart attack, it is silent, it's symptomless. The patient wouldn't know that he had a heart attack. And again, that's why we screen with the ECG. Another manifestation of heart-related disease will be extreme tiredness for no good reason and shortness of breath on exertion. So the heart is very, very important. And in fact, that's the way most diabetics live this world or die. Yeah, it's usually a heart-related problem. The other heart-related problem is stroke. And stroke, again, is death or damage of portion of the brain because of lack of blood flow or rupture of blood vessel within the brain. and typically is sudden in onset. The patient could have difficulty with eyesight in one eye. Patient could feel numbness and tingling and/or weakness on one half of the body. And then onlookers or neighbors or family members could notice a deviation of the corner of the mouth. So these are some of the warning symptoms that indicate a stroke. Sometimes before the full-blown stroke happens, some and not all of these symptoms will occur, and it's very important that the patient sees a doctor immediately, because if the right steps are taken, development of a full-blown stroke with paralysis of one whole half of the body can be avoided. And another manifestation of a stroke, which everyone should know about, is difficulty getting your words out. You know what you want to say, but the words will not just come out. It's a manifestation of a stroke. Another common heart-related complication is, again, I'll use the word death or destruction of the tissue in the lower limb, which then becomes painful, dark, smelly, and we call that gangrene of the extremity, because the extremity or the lower limb, especially the foot and the toes, don't get enough blood flow and oxygen, and that results in their death. And a diabetic patient can lose a limb because of this complication. Obviously, it's going to affect the person's quality of life. The second long-term complication that I mentioned earlier is kidney failure. And usually this occurs in association with high blood pressure. If you go for checkups and this complication is detected, there is treatment for slowing down the process so that it doesn't advance to the point of needing dialysis, which Ghana can scarcely afford. So you have to take good care of your kidneys if you have diabetes, so that the patient doesn't develop kidney failure. And the kidney failure usually occurs in association with high blood pressure. The two together will lead to the kidney failure. Diabetes can cause blindness. In fact, it's one of the leading causes of blindness. And therefore, if you're a diabetic, part of your management will be periodic examination of the back of your eye, so that if there is early damage, then we have ways of treating and avoiding progression of the damage to the point of one getting blind. Finally, one of the long-term complications of diabetes is nerve damage. The nerves help us feel touch, help us feel heat and cold, help us feel pain. When you have diabetes for a long time, the nerves get damaged, and your ability to feel these sensations is reduced. It's reduced to the point that you can damage or hurt yourself without even knowing that you have done some damage to your foot. And therefore, proper foot care. A diabetic should be interested in the health of his or her feet at all times, in order to avoid further injury and possible loss of a limb because of this complication. In addition to the long-term complications that the diabetic lives with for many years, there are also short-term complications that can take away the patient in the space of a few days or a week. So a diabetic should know what the short-term complications are and be on the lookout for these. Diabetics are very prone to infections. And infections can, common areas of infection include skin in the form of boils, or if you have an injury, the wound becomes infected, and then there can be a spread of the infection under the skin. They can have infection of the urinary tract. Urinary infection is common. And chest infection and pneumonias are common. So every diabetic should be aware of the possibility of this infection. And when his or her condition changes in a short space of time, the medical attention should be sought, because infections can spread like wildfire and lead to death in a space of a few days. Infections. Okay. The second short-term complication is the development of low blood sugar. Low blood sugar. Now, the sugar is high, so we treat it with drugs that lower the blood sugar.
Dr. Lutterodt.
You are in
Yes.
class.
No. So diabetes
Yes.
talk.
Should I continue?
The same Lutterodt that comes from.
No.
That collection.
Not Counselor Lutterodt.
Low blood sugar is a complication, unintended complication of the treatment. If your doctor gives you too much blood sugar lowering drug, you'll be liable to develop low blood sugar. If you take your blood sugar pill and you don't eat, the blood sugar will go low and you experience complication. If you exercise vigorously after taking your blood sugar lowering drug, again, that can contribute to your sugar being too low. When the blood sugar becomes low, you begin to feel your mind becomes foggy. You can't think straight. You feel hungry, you will shake, you will sweat. So any of these symptoms should alert the patient to the possibility that the sugar may be running low. That's why we ask patients, that's one of the reasons why it's advisable that the patient periodically checks the blood sugar. And a diabetic should always have near him or carry with him a sugar-containing drink or toffee or candy or chocolate. And when this spell or these combination of symptoms are felt, drinking, say, a bottle of Coke or orange juice or pineapple juice, the person, it's like night and day. The person feels much better. And when this should happen, the patient should inform his or her doctor, because the blood sugar medicine that is taking may be too much. In fact, I warned and advised that this complication can be so serious that if intervention or correction is not done in a timely manner, the patient can become unconscious and can die. The patient can develop convulsions from the sugar being too low. And this is all because our brains need sugar to function. And if the sugar is too low and the brain doesn't get the energy it requires, all the symptoms that I described will follow. So the last point is impairment of level of consciousness. You can become unconscious. And quite apart from blood sugar being low as the reason for unconsciousness, another reason for unconsciousness is development, especially in the younger diabetic, type 1 diabetics. They can develop high sugar with a lot of acid in the blood that can make them become comatose. It's a medical emergency for which hospital treatment is required. Can diabetes be prevented? To a fair degree, yes. The answer to that question is yes. So we are encouraged to regularly exercise, and you need not go into a gym. You need not buy expensive equipment. Simple 30-minute, 45-minute walk a few times a week would do in order to keep your BMI or your weight in relation to your height in the appropriate, within the normal range. By watching what one eats, one can prevent diabetes. And diabetes, in diabetes, we try to reduce the amount of starchy food in our meals. So starchy foods should be, the intake of that should be reduced. If you have diabetes, we encourage the blood sugar to be checked a few times in a week so that the doctor, you and your doctor know where you stand at in terms of how well you are controlled. Good control means less complications, means living longer with the diabetes. A diabetic should attend follow-up clinic as recommended by a physician, because we need to constantly be monitoring for the complications that I mentioned earlier. A diabetic should take very good care of the feet. A cut, if you trim your toe and you cut yourself and you don't feel that you cut yourself because the nerves are damaged and you are prone to infection, that's a deadly combination. The infection will spread. You could lose your life or you could lose a limb at the minimum. So foot care is very, very, very important. And I'll stress again that it's a condition that the patient lives with for a long time. So the diabetic must invest time and personal interest in his or her ongoing management in order to achieve good control and therefore minimize the risk for complications. Treatment of diabetes is possible, and one way of treating some diabetics are on injections of insulin, which is what they lack, and hence the development of diabetes. So patients may be on insulin, some may be on insulin. Not everyone needs to be on insulin. The young ones, the juvenile type, they almost always need to be on insulin because they lack insulin totally. Adults, some will get by, or majority will get by without insulin. Some, a few may need to be on insulin. And again, of course, your doctor will discuss with you that there are different types of insulin and how frequently it should be given and when it should be given, that kind of education. In fact, usually we work with a diabetic nurse who will do some teaching, particularly relating to diet and insulin injection, and then the lifestyle modification that will lead to reduction in the development of complications. Yeah. Then we have pills or tablets that we use for controlling insulin. There are different kinds. And if you are in tune with medical development, there are newer and newer pills coming out, newer and better medications coming out for the control of not only diabetes, but even for reducing weight. These are becoming increasingly available. And some of the drugs work by squeezing insulin out of the pancreas, which produces insulin, producing much more than the person is able to produce by himself or herself. And that way the blood sugar is regulated. Some of the newer ones like Forxiga that I've mentioned there and Galvusmet are more expensive, and they equally work and control the blood sugar very well. If a patient is diabetic, majority of them, or a fair number of them, end up being on blood pressure control medications because the two conditions go hand in hand. Also, some patients will need to be on a cholesterol lowering medication. One should at all times try to comply with these medications in order to improve control and reduce risk for complications. So you may wish to know, well, how do I know that my diabetes is well controlled? If your fasting is, we aim for a fasting between 6 and 9 millimoles per liter. And then 2 hours after a meal, it should be less than 10. If it's less than 10, we are happy. The doctors are happy. And also, the 3-month average A1C, we aim for it to be less than 7% or less. That means you are very well controlled. And that you as a patient, you should know these numbers and be asking and be aiming, be interested when you go for tests to know what these are. Keep a record so that you yourself know whether you are doing well or not. So I think that was the last slide, and I will stop here and answer any questions that some of you may have. Any questions?
Hello, good evening.
Good evening.
Dr. Lutterodt, thank you for your insightful presentation. Please, I'm Augustina. I'm a midwife at Ghana, Canada. My concern is in this age of weight gain, most people are trying to lose weight by taking the diabetic medications. So I want to know, is it good? Is it recommended we encourage them to take it? Because most people go ahead and take metformin and Ozempic for weight loss, even though most of them, their sugars are normal.
Okay. Yeah, increasingly there is more evidence that these drugs truly and indeed lower bring about a decrease in weight by affecting appetite, especially, so the patient eats less. It's increasingly being accepted as an indication, quite apart from the patient having diabetes. If the patient has diabetes and they take, say, Ozempic, it's an added bonus because the sugar will be controlled, and at the same time, the patient will lose weight. When the patient loses weight, the small amount of insulin, the relatively small amount of insulin that the patient has becomes a lot, and hence the blood sugar is easier to control. So the answer in short is yes. Increasingly, these drugs are going to be allowed. It's going to be allowed for these drugs to be used solely for weight reduction. That's the direction we are heading. The world or the medical field is heading. Next.
Thank you, Dr. Lutterodt.
Next question, if any.
Okay, Dr. Lutterodt, this is Portia. There's a question in the chat console. It says that can diabetes be cured completely?
I believe the answer is yes and no. In fact, I have, and I'm sure others have also had, patients who are much overweight. And if the patient loses enough weight, the diabetes will go away. You can call it, quotation marks, a cure. And that is because they become more sensitive to the little insulin that they produce. It becomes enough. When you are obese, you have insulin. In fact, like I said earlier, some have even too much insulin, and yet it's not enough because of the obesity. If they lose weight sufficiently, the little insulin that they have becomes enough, and the blood sugar, diabetes seemingly disappears. Yeah. Now, for how long the diabetes disappears is variable. It may reappear. Say this happened at the age of 40 when you lost weight and the diabetes went away. Maybe in your 60s or 70s, the diabetes will show itself again. And that's why I said yes and no. Yeah. So yes, it can be made to disappear. Now, what I would call a cure in the real sense of the word, I'm not sure. Yeah.
Okay, thank you. So there's another question. It says that, can you take metformin if you are pre-diabetic? Can you take metformin?
Yes, yeah. That's a good question. There's some evidence to suggest that yes, from you can be prevented from becoming openly diabetic by taking metformin. Because metformin makes the little insulin that the patient has more effective. So that way the sugar becomes lower. And metformin apparently reduces appetite. That would be another mechanism. And you may lose a few pounds of weight. Yeah. Yes. So it can be used, yeah, for the pre-diabetic to prevent him or her from becoming openly or definitely diabetic.
Okay, thank you. There's another one from Jennifer. She says, can a diabetic patient fast?
You mean religious fasting?
Religious fasting, I believe.
Yes, yeah. That can be, it depends. You can't take your diabetic medicine and fast because then you're asking for trouble. The sugar may go too low and then you'll be in trouble. You suffer from hypoglycemia or low blood sugar. If you have the juvenile type, if you fast, when you fast, the body uses fat for energy instead of sugar. And when you burn too much fat, you can develop a complication, especially in the young ones, called ketoacidosis. The blood becomes acidic, and the patient can be fairly sick with the sugar going high. Yeah. And so, for this reason, it wouldn't be recommended. Yeah. Particularly type 1 diabetics. It wouldn't be recommended. And if one is going to do it again, fasting for how long is the question? If the fast is going to be broken at midday, maybe it's not as bad as at night or in the evening or overnight. Yeah. So I don't know. People fast for different durations. Yeah. So it should not be done, or if it's done, the time and duration should be short, and the blood sugar should be monitored. And for type 1 or young diabetics, perhaps I'll say no, because they are more likely to burn fat and then develop complication that can be life-threatening.
Okay, thank you. So there's another one from Evans, and he says if ketones are found in the urine of a diabetic person, does that mean his or her kidneys are in danger?
No, not at all. In fact, ketones in the urine necessarily is not associated with diabetes. A normal person who fasts will have ketones in the urine because it's burning fat. All right. And it's got nothing to do with kidney function. Yeah. So all ketones in the urine, if you are not diabetic, it means that you have not taken in enough starch. You are burning fat. That's what it means. Yeah. The body is using fat as a source of energy instead of carbohydrate or sugar.
Okay, thank you. There's another one from Justice. Justice is asking how expensive is the management of diabetes? How expensive is the management of diabetes?
It is expensive because, like I said, it doesn't occur, it doesn't stand alone. It occurs in combination with high blood pressure and high cholesterol. And then you throw in the complications, other complications that may arise. You may need medical supplies for them. So on the whole, it's an expensive disease. The newer ones like Ozempic are even more expensive than the older medications that we used to use, like glyburide, glimepiride, which some patients use. I've seen some Ghanaians on those medications and that family. So the older medications are less expensive than the newer ones. The newer ones are more expensive. So if cost is an issue, don't hide it from your doctor. The doctor should be able to strike a compromise and give you a drug that will work but less expensive. Yeah. But the simple answer is yes, it's an expensive disease. The treatment is not for a short term. It's not like you have a urinary infection, you take antibiotic for a week and stop. This, you'll be taking it for the rest. The diabetic treatment is for the rest of the patient's life. So it can be, money can be a problem.
Okay. So there's a last one from Harriet, and she says, are diabetics supposed to be on special diet even if they are on medication?
Yes. The answer is yes. They go hand in hand. The diet complements the drug treatment and brings about improved or better control. Definitely yes. Yeah, definitely yes. Yeah. And equally important, I would say. Yeah. Mm-hmm.
Okay. I think this is about the last one from Winner. Winner is asking, can someone without diabetes do intermittent fasting to prevent diabetes? And is it a good thing to have ketones in the urine?
No, you can't prevent diabetes by doing intermittent fasting. No, you cannot. Yeah. And then, is it good to have ketones in the urine? Ketones, like I said, is a waste product. And ordinarily, sugar or carbohydrates are used as a source of energy. When you fast and you don't eat, the body has a reservoir of fat that it tends to as a source of energy. And that is what leads to the production of ketones in the urine. And like I said, it's not indicative of any disease, especially if you are known not to have diabetes. Now, ketones in the blood, which we don't do here often. Elsewhere, if you want to know whether a patient has diabetes-related ketone disease, you check the ketones in the blood. That is specific. When it's in the urine, it doesn't necessarily follow that the person is diabetic. Well, it's a simple fasting. Going hungry for a long time can cause ketones to appear in the urine.
Okay. I think that's about the last question for tonight.
All right.
Okay, so I think on behalf of management, I would like to thank our physician specialist, Dr. Lutterodt, for taking time out of his busy schedule to take us through this talk. It's been very, very insightful, and I believe that all of us, we've had our takeaways and will take cautions in order to prevent diabetes. And so for those of us who joined, we have a WhatsApp group that if you are interested, you can leave your number in the chat console and we'll add you to the group. And as and when we have such health talks, we will inform you accordingly. So you can just leave your contact and then we'll add you to our WhatsApp group and then we'll give you updates on our webinars and other health events. And so without much ado, Dr. Lutterodt, with your permission, then we would like to officially close this meeting.
Okay, thank you.
Thank you too.
All right,
yeah. Thank you all for joining. And we'll meet next month for another insightful session. Have a good night.
All right, thank you. All right, yeah. Sammy?